Warning, we're about to answer the plastic surgery questions that everyone has, but is too embarrassed to ask. Let's pretend you're asking for a friend. No judgment, no awkwardness, just honest answers to the questions everyone Googles anyway. All right, so let's get going. Number 1, can my breast implant pop if someone squeezes it too hard? Silicone implants are engineered to be extremely robust. I've seen people drive cars over implants without them being damaged. I wouldn't necessarily try that at home, but theoretically you could. So in the course of normal activities, it is extremely unlikely that your breast implant is going to rupture. Next up, can people feel your implants during intimacy? Your plastic surgeon is going to expend a great deal of effort designing your operation to fit your lifestyle. And there are lots of decisions that we can make to make breast implants as hard to feel during intimacy as possible. This ranges from where we're placing them. Are they going under the pectoralis muscle or over the pectoralis muscle? To the kind of implant that we're using. In most cases, you can feel implants to some degree during intimate activities. However, most people report that it doesn't make a difference. Can I sleep on my stomach after a breast augmentation? After a breast augmentation, you have to take very special care of your implants for a certain period of time. We're going to walk you through a graduated recovery program to make sure that you're optimizing your results for the long term. In general, we're okay with you sleeping on your chest after a breast augmentation if you wait for about 2 weeks. Can you wake up during surgery? I work only with a board-certified anesthesiologist in a state-of-the-art quad ASF level C operating room. This is an individual who is highly trained to keep you safe and comfortable for the duration of your procedure. It would be extraordinarily unlikely for you to wake up during surgery. In fact, I don't think it's ever happened in my operating room. Can filler move to another part of your face? When we place filler, and the most common ones are made out of hyaluronic acid, great care is taken to put it in exactly the right position so it's doing what you want it to do and not doing what you don't want it to do. It is possible for filler to migrate. This is something that we try to take into account when we're planning your injectables, but this is something that can't be prevented 100%. If filler does migrate, there are several things that we can do about it to help you get the result that you're going for. What happens if I don't ever dissolve my filler? This really depends on the kind of filler that you're using. Most of the fillers that we're using today are made of hyaluronic acid. This is a naturally occurring substance. It's found in the human body already in places like the joints. It's actually even in your eyes. So the hyaluronic acid fillers, which are so popular, will dissolve on their own over time. In terms of how fast your body dissolves these fillers, it depends on the specifics of how these fillers are made and where they're placed. So for fillers that are more heavily cross-linked, like a Voluma, for example, they'll tend to last longer, often for out to 2 years. For fillers that are less highly cross-linked, like Juvederm Ultra Plus, that's going to go away more quickly. In terms of exactly how long these things last, it depends where you're putting them. If you place a filler in a very mobile part of the face, like the lips, your body's going to generally dissolve it more rapidly than if you're putting it in a less mobile place, like along your cheekbone. If you never dissolve your filler, your body will probably do it for you. Can you tell if someone has fake lips, even if they think they look natural? It is a critical part of facial balancing and injectable filler treatment that you are adhering to the aesthetic goals of your patient. In my practice, we prioritize a natural, undetectable aesthetic. So the goal is for you to never be able to tell that one of our patients has filler. Do facelifts make your ears look weird? When we're doing a facelift, the incision is generally hidden in the creases around and behind the ear. We use that access to access the deeper structures of the face and resuspend them to rejuvenate the face from its foundational layers outward. So in a properly done facelift, your ears should not be distorted at all because one, all of the tension, all of the load bearing is being done by the deeper tissue layers. And two, the way that the incisions are designed and the closure is anchored should really put no tension on that closure at all that might pull on or distort your ears. For a facelift that isn't designed optimally, there are ways that your ears can be distorted. One example of this is the pixie ear, where the earlobe kind of runs into the side of the face and gets pulled down and looks quite odd. And that's a dead giveaway for a facelift. Will TSA see my plastic surgery in the body scanner? TSA uses very sophisticated scanners to detect anything that could possibly cause harm on an aircraft. The exact kind of scanner that's used varies from airport to airport, even sometimes from terminal to terminal. So first of all, in terms of if they can detect that you've had plastic surgery, it depends really what kind of scanner they're using and what kind of plastic surgery you've had. For example, if you've had breast implants, virtually any airport security machine can detect those. On the other hand, I really can't think of a way that most airport scanning technology would be able to detect a facelift. Can liposuction fat come back somewhere else? This is a great question that I get all the time, and to understand the answer, we need to talk about fat biology. When we remove fat with liposuction, the fat cells are permanently removed from the area that we're treating. However, when you gain weight, you're not actually making more fat cells. What you're doing is asking your existing fat cells to hold on to more lipids, so your existing fat cells grow. When you lose weight, the opposite is true. You're not destroying fat cells, but instead, your lipid stores are declining and the volume of your adipocytes, your fat cells, is decreasing. So when we remove fat cells from a part of the body during liposuction, we're doing nothing to change your metabolism. So your body is going to need to store those lipids somewhere. They tend to go where you store fat preferentially anyway. So for example, if you're having abdominal liposuction and you're someone whose weight goes to their breasts or their buttocks, that's probably where the fat is going to accumulate after you have liposuction. The truth is that there is often a fairly even distribution of fat around the body after liposuction. And when you think about it, in most cases, the volume of fat that we're removing during liposuction compared to the entire surface area and volume of the body isn't necessarily that significant. So you would probably never even notice the redistribution of fat. What happens to my breast implants if I gain or lose weight? If you gain a significant amount of fat after breast augmentation, let's think about what happens. Your implants are going to remain where they are, but your body's going to be depositing more fatty tissue around them. This could change their appearance in the sense that they might become less obvious if they were obvious in the first place because there is now more tissue to camouflage them. It can also obviously make your breasts look bigger, which would change the appearance of your breast without really altering your breast implants at all. Things get a little bit more interesting when we talk about what happens if you lose weight after you have breast implants. When we do a breast augmentation, we go through a lot of trouble to make sure that we do it in such a way that they are camouflaged in your existing soft tissues. If you lose a significant amount of fat after breast augmentation, it's possible that if we were relying on that fat to camouflage the breast implants, they might become more obvious. So it's best to have an operation like a breast augmentation when you're at your goal weight and you've been steady there for some time. The other thing to consider is that if you lose a significant amount of weight after you have breast implants, there can be real skin laxity or loose skin of the breasts. This can lead to drooping or ptosis, and this might be a case in which you would have a mastopexy or breast lift to restore your breast aesthetics to what you'd like them to be. Can I breastfeed after I have breast implants? Breast implants can be placed in several different parts of the breast, and they can be placed through several different access points. For example, we can put breast implants under the pectoralis muscle. We can put breast implants over the pectoralis muscle, or we could actually put breast implants in the fascia or between the fascia and the pectoralis muscle. We can also put implants in through various different routes, such as through the fold under the breast, incision hidden at the border of the areola and the regular breast skin, or we can even put them in through your armpits. Each of these carries a different theoretical risk in affecting your ability to breastfeed. The truth is, we don't have great data on this because we don't know how well you can breastfeed before you have a breast augmentation. It stands to reason, if you think about things empirically, that if you were to put an implant under the pectoralis muscle through the inframammary approach, that's through the fold under the breast, you're steering pretty far clear of the milk ducts and the breast gland. So it would make sense that anatomically, you wouldn't be doing much to disrupt the ability to breastfeed. On the other hand, if you're going through a periareolar approach, that's when you're using the incision at the border between the areola and the breast skin, and you're going to put that implant either above the muscle or below the muscle. Either way, you're dissecting right through the glandular breast tissue and the milk ducts, so it stands to reason that that approach might put your ability to breastfeed at more risk. In all of these cases, though, it's important to know that any disruption to your ability to breastfeed would come from physical damage to the structures of the breast. There is no evidence that the substance within a breast implant, whether it's silicone gel or saline, has any adverse effect on the quality of your breast milk. If I stop Botox, will I look older than I did before? Let's talk about how Botox works. Botox is used to decrease lines or decrease the prominence of lines caused by the muscles of facial expression. These are also called dynamic rhytids or dynamic wrinkles. They're the ones that show up when you're moving your muscles of facial expression. Botox really isn't designed to treat static rhytids or the lines that are present when your face is at rest, like the nasolabial folds. So when we inject Botox, it in a very controlled way decreases the activity of the targeted muscles of facial expression, and that makes them move the underlying skin less when you're being expressive, so that the lines caused by skin motion are less apparent. It stands to reason that if you were to stop using Botox, those effects wear off, and you go back to looking like you did before you started using Botox in the first place. One exception is that if you've been using Botox for a very long time, this can lead to long-term muscle atrophy. That's a weakening of the muscle that can persist even after you stop using Botox. In those instances, your results might remain fairly stable for a pretty long time, even after you stop actually having Botox injections. Can Botox permanently paralyze my face? Botox is an injectable neuromodulator. It's a substance that we introduce into the target muscles, and it inhibits their ability. It interferes with the ability of the nerves in the area to stimulate those muscles to contract. Over time, your body degrades the Botox that we've injected, washes it away, and it just stops doing its job. So it is very unlikely, in fact, I'd almost say impossible, but I never like to say anything is impossible, for Botox to permanently paralyze your face. How can you avoid that wind tunnel look after a facelift? When we do a facelift, we are operating on the deep layers of the face. We're manipulating the SMAS. We're often working in the deep plane. And the effect of this effort is that we are repositioning, we're resuspending the deepest foundations of the face. So the skin is just coming along for the ride, and there's virtually no tension at all on that skin when we're closing a facelift. And when you do a facelift that way, you're not going to look windswept. This kind of caricaturous windswept approach is what happens if you're putting tension on the skin to do the lifting work, so that when you're pulling the skin and you're doing a facelift that way, it really can look like you're in a wind tunnel. So the moral of the story is make sure you're going to someone who is not doing a skin-only facelift. What's the youngest age at which you'd recommend a facelift? A facelift is designed to restore a youthful appearance. It will address laxity in the aging face. It can also address volume loss in the aging face. The right age for a facelift depends on what your anatomy is doing at a given point in time, and also what kind of facelift you're having, and finally, what your aesthetic goals are. So it's possible that someone might have lost a lot of weight. That's happening more and more with GLP-1 medications, causing significant facial skin laxity, which might lead us to recommend a facelift much younger than we would have in the past, sometimes even in patients' 30s. Even outside of GLP-1 based weight loss, the trend now is that people are having more and more natural appearing facelifts earlier in life, again, even in their late 30s, early 40s, to age more gracefully or in a more aesthetically pleasing way over time. In terms of when I would recommend a facelift to someone like that, it really depends on what their individual goals are. Where are all the places somebody can get liposuction? So liposuction is a procedure in which we're making a tiny, usually 3 millimeter access point, numbing the tissue, and then suctioning out extra fat. We have different kinds of liposuction cannulas or instruments that can be used all over the body. Some of the most common places people are getting liposuction is their abdomen, their waist, kind of the love handle region, the chin, the arms, the legs. You can do liposuction almost anywhere. One place that I would really strongly caution against having liposuction is the middle and upper thirds of the face. This is a place where volume and preserving volume is what really helps you look young and youthful as you age. It's okay to very carefully liposuction the lower facial third because, if anything, as we age, we tend to get a more square-shaped face as that volume descends. So we're actually restoring a natural heart-shaped face by liposuctioning these regions. Do adults ever get their ears pinned back, or is that just for kids? Ear pinning, or otoplasty, is a very powerful operation that can be very helpful for people whose ears are prominent and for whom it's causing social distress, or if they just don't love the way that it looks. It's very common for parents to bring patients in, younger patients, who are getting bullied in school because of their ears and consider an otoplasty or ear pinning procedure. It's also, and while it's probably not as common, we do periodically see adults that for whatever reason, at this stage of life, they just don't love the way their ears look. And in that case, yes, we will absolutely do an otoplasty in an adult. Can your ears unpin themselves? An otoplasty or ear pinning procedure involves deep structural work in which we're doing a couple different things between actually molding or cutting the cartilage of the ear and placing very specific sutures to maintain the shape that we're trying to create. It's very unusual for an ear to unpin itself after otoplasty, but it's not impossible for that to happen if one of the sutures breaks or if the cartilage molding doesn't hold. But this would be a complication of the procedure, and it's extremely unusual. Has the patient ever said something that got them in trouble when they were waking up from surgery? I can't tell you. Okay, just kidding. So when you undergo anesthesia, it's going to decrease your inhibitions. It almost feels like you're very drunk. And when you're waking up from anesthesia, you have that same feeling. You're disinhibited. So it's entirely possible you could say something embarrassing as you're waking up from surgery. It's actually pretty unlikely. I haven't seen it happen that many times, but it definitely can happen. Fortunately, everybody, every physician, every healthcare provider is bound by the privacy laws, by HIPAA, so that nothing you say in our healthcare facility is public domain. Your secret is safe with us. Which celebrity has the best plastic surgery that I've ever seen? What I'll say for this is that celebrities absolutely have their right to privacy. If they want to share that they've had plastic surgery with the public, good for them. I'm always happy to discuss details of a procedure that a celebrity has disclosed so that we can learn more about it. I never like to speculate about what someone has or hasn't had done, as I think that kind of borders on an invasion of privacy. That said, I've seen some celebrities with remarkably great natural work, and others less so. Which celebrity trend do I wish would disappear? The overarching theme is that I really don't like it, or I feel bad when I see celebrities, or anyone for that matter, having plastic surgery for other people. This is something that we should be doing for ourselves because it makes us feel better, because it addresses the personal insecurities. But the second you're having plastic surgery for some external reason, maybe you should reconsider what you're doing. What procedure do people regret most frequently? In my practice, I see a lot of revisions from other plastic surgery centers. The two things that I'm seeing regretted most frequently are actually on different kind of sides of the body. I'm seeing a lot of women that have gotten breast implants that are much larger than they'd like, and we're downsizing them, we're entirely removing them and doing a lift. I'm also seeing a lot of people coming in regretting that they've gotten kind of an extreme Brazilian buttock lift And that's also something that we're doing a lot of reversal of these days. And this really ties into the kind of more natural aesthetic that we're seeing in the practice more and more. Can you undo bad plastic surgery, or are some mistakes permanent? Plastic surgery involves often significant manipulation of the tissues of the body. We are making incisions, we're creating suture lines, we're reorganizing, we're repositioning, we are resizing. Most of the time, we can revise or correct even significantly unfortunate plastic surgery results. There are definitely times, though, where we just can't restore things back to their original state. This is why it's especially important that you always choose a plastic surgeon who's board certified by the American Board of Plastic Surgery to ensure that you're getting results that are of the highest quality and are maintained at the highest standards. Plastic surgery can be intimidating, but it shouldn't be mysterious. The more honest conversations we have, the more informed decisions people can make. Drop your most uncomfortable questions below.